all agree that none of us were prepared for this. We have never been through anything like this. Because of the demand for this information, we will be repeating this webinar on Thursday at 1 p.m. Please let us know if any other business owners, if there are any other business owners you would like to invite and for us that we can extend an invitation to. We will also have this webinar posted on the Braden Benefits website in the blogs section and on the HRTG Atlanta website. Because of the volume of information we are going to present, we would ask that you message us, and I believe you can do that right on the webinar, if you will message us with your questions. If we have time, we will answer these questions at the end of the webinar. Please put your email address on the question, and those questions we are unable to answer, we will email you before the end of the week. Please know things are changing rapidly. The situation is fluid, and as adjustments are made, we will do our best to communicate these. At this time, please allow me to introduce Helene Grossman. She is president of HRTG Atlanta. Helene has been in human resource management for more than 15 years. Helene and her team have worked with companies such as Kimberly-Clark, as well as a very large number of smaller companies. Braden Benefits refers HRTG Atlanta to many of our clients in need of help with the human resource management. Helene is joined today by her two consultants, Cindy Durden and Heather Steele. Helene?
Thank you, Victoria, and thank you to everyone. We really, really appreciate your attendance. Again, just a reminder to mute your phone and put your questions in the chat box, and we'll do our best to answer it. We have been hearing from all our business partners that there is just a lot of information to absorb right now. I mean, it is coming at us so quickly, and we've been asked to try to provide some guidance on how to get through this. So today's presentation is really going to be around a couple of best practices for you to think about, as well as try to give you some clarity on the legislation that has come out, because it is also coming out fast and furious. And as Victoria mentioned, it changes quickly. So we're trying to get it nailed down, but we will give you the information that we have right now. So, oops. Let's see, why is this going? So with this, let me just start with a couple of best practices, things that you should be doing right now, and you probably are already doing this, but let me just repeat a couple of the things. Number one, obviously following whatever the CDC and any other government guidance is providing you. Number two is just contingency planning. And this is really about what ifs. This is about thinking ahead, especially through the next month. And through the month of April. Number three is thinking about what your work at home systems and policies are going to be. If it does apply to your business, in many cases it may not apply to your business, so that's a different conversation. But if it does, what does that look like for you? Number four is just communicating every day. Spending time talking with your workforce, talking with your leadership. I have talked to many businesses who every morning have a quick check-in about what is going on for the day, what is going to be happening the next day, because it changes so quickly. And then lastly, we ask, obviously, if you're able to do that, consult with HR and legal. And I am going to add into that, based on the next thing I'm going to talk to you about, probably your CPA and accountant, because you're going to see a lot of information coming out from the government concerning money and dollars. And as a result of that, it'd be nice to have that all in one location in place so that you will have easy access to that once you're starting to ask for those monies. So again, just some general thinking topics for you to keep in mind as we work through this. All right, so today, in terms of the discussion, we'll be talking about how to manage your business during COVID-19. Number one is we're going to talk about how you keep track of all those expenses. Number two, we want to just do a little refresher around personnel. and some definitions, because you are going to have to make some decisions around that. And then some decisions around retaining, layoff, and furlough, and we'll get into those definitions for you as well. Thirdly, we'll talk about the legislation that has come out for the tax credits, 5 exemptions, and 6 the health plan mandate. So that is what we're planning to cover in today's webinar. So number 1 is around keeping track. As I mentioned to you before, there is going to be a lot of government assistance coming out. Our recommendation, however you want to do it, is to just add an expense line. And if you need to do subgroups within your expense line, call it COVID-19, and this just dump any expenses you have in there, including staff, personal time, that you are spent dealing with this crisis. It'll be easier for you to apply for the government assistance if you know where it's at and you don't have to go searching for it. So that's just a general recommendation that we have conferred with a couple of CPAs and CFOs, and they're all saying, yes, please do this. It'll just make our life easier when it's time to apply for that government assistance. So just make plans to keep track. All right. I do want to talk briefly before we get into legislation around your workforce. In your workforce, you have at this point probably 2 major types of employee classifications. One is exempt, or what we call non-exempt salaried. In either case, it is salaried employee. And those employees must be paid regardless of the number of hours they work each week. Okay, so even if they work 1 hour in one day, they need to be paid for the week. Okay, you may have exempt salaried employees who work 65 hours a week. You're still paying them for the 40 hours a week. It's a straight salary. Okay, then you've got your non-exempt employees who are hourly. Okay, and you only pay them for the hours they worked. So if they worked 1 hour in one day, you're going to pay them for that 1 hour in that one day. Okay, this is really important for you to understand. Hopefully you do, but we can always answer questions around that because obviously this is determining how you're paying people on payroll. And there is a note that during this, crisis and during this time frame, you do have the ability to change an exempt employee to a non-exempt employee based on your business needs. Again, we can help you with that. But if you decide, as an example, that you have an exempt employee who works 40 hours a week, and you've decided that you only need them to work Monday, Wednesday, Friday, okay, and only want to pay them for that, then you can make the switch and make them an hourly non-exempt employee and pay them for those 3 days. So that is an option for you to take a look at as you're looking at your employees. Your personnel as a whole, and again, this is part of contingency planning, is what personnel do you really need for your business to operate right now, okay? And especially during the next month, I would tell you, or the next 8 weeks. Who do you need to keep the business operating? How many people do you need? These are all questions that you'll need to be asking yourself. And then along with that, are there folks that can do their work from home? Okay. Are they able to do that? And if they are, then we need to establish some guidelines around working from home. And again, there's a work from home policy, or there's guidelines that we can help you with. You may already have that. If not, let us know. We certainly can help you with that. But again, who can do their work from home, who cannot, okay? And then thirdly, as you're looking at your personnel and you're determining what you need at least over the next 4 to 8 weeks, you need to make a determination, can I retain all these people on the payroll during this time frame? If not, who do I need to lay off? And if I don't want to lay them off, who I can furlough. And I'll get into those definitions in a second. But again, looking at your entire workforce, this is important to determine as we move forward, retaining them, laying them off, or furloughing them. So what is the difference? If you're doing a layoff is a full separation from the company, and these people are not returning to work. Usually, I mean, many of you have done terminations. It's exactly the same thing. You're terminating their employment from the company. The benefits usually end at a certain point at their termination, and you do not intend to bring them back. If it's a furlough is a temporary unpaid leave, okay? So you may decide that I do not need certain employees for the next 4 to 8 weeks, but at the end of the 8 weeks, once business comes back to normal, they're coming back. I need them. So we call that a furlough, okay? They're still on your payroll even though you're not paying them, okay? Benefits can continue during that time, and you can figure out ways to work that out with your employee. Either A, they will pay you during that time their portion of the premium. You can defer it. You can pay their premium for them. There's lots of different scenarios that you can work through with your employees if they are on benefits in your company and you furlough them, okay? The note down here is that even if an employee uses vacation time or personal time during the furlough, they still are eligible for unemployment benefits, which is the next piece, is that whether you have a layoff or whether you have a furlough, either way, the employer must file for unemployment with the DOL. Now, I will tell you that we have links to the Department of Labor, because in Georgia, and I'll only speak for Georgia right now, we'll have to look at other states if there's folks that have people in other states. But in Georgia right now, Georgia is asking all the employers to file unemployment for the employee via this link. The reason obviously is lack of work. This eliminates that DOL 800 form that you always have to fill out, and your company will not be hit with a high unemployment rate the following year. But basically you are doing the work for the employee because the unemployment office in Georgia is closed. They do not want anybody going down to the unemployment office. These employees do not need to be going down there, filing anything, having meetings, etc. And this way, by you filing the unemployment for them, they will get their payment sooner. Right now, they're telling us 48 to 72 hours after you file for them. Again, we'll wait and see, but that is what we're being told at this point. So this is your responsibility, employers and businesses, that if you do go through a layoff or a furlough, you do need to file the unemployment for that employee. Okay, so a lot of decisions, a lot of thinking through what's going to happen over the next, 4 to 8 weeks as you look at your business. But that again is something that you need to do as you're determining, what your employee needs are going to be, how many people need to be working with you at this point. And again, we can help you through that. All right, so right now, and I'm going to jump to legislation. So right now, there's been a lot of legislation that has come out, and I just want to break it out for you for clarity. So the first part, you may or may not have heard about this, but $8.3 million, I don't think it's million, that's probably a typo, it's probably billion, for testing, research, and acquiring healthcare equipment. This has already been in place. And this started about a month ago. So that is part one of the legislation. That was already done. What you're hearing a lot about, and what I am going to cover next, is what we're calling the Families First Coronavirus Response Act. You may have seen it referred to as the FFCRA, and that's exactly what it is, Families First Coronavirus Response Act. That is the one that came out, I believe it was a week and a half ago. This is the one with paid leave and extended FMLA, which I will talk through next. The third act, which you have heard about as well, was the one that was signed by the president on Friday night. That was the Coronavirus Aid, Relief, and Economic Security Act. They're calling it CARES. Again, with him just signing the act on Friday and today being Monday, we are still getting all the specifics around the legislation and what that means for you. But this is the one that you hear a lot about in the news. You're hearing about rebates to Americans, whether it be direct deposit or with checks. You're hearing about forgivable loans for small businesses, payback protection programs, an employee retention credit. So lots of good information and lots of good information and rebates for small businesses. I will not be covering that today on this presentation because, again, we are just getting the specifics of that. So as soon as we have the next round of how that's going to be implemented, we will definitely get that out to you. But as for right now, we're going to focus on part 2, which is the Families First Corona Response Act, which begins now, April the 1st. It takes effect on April the 1st, and the sunset is on December the 31st of this year. Which employers are covered? The employers that are covered are less than 500 employees. That is the number. So there is another plan for businesses that are greater than 500, but this particular act is for employers that have 500 or less employees. So there's 2 parts of the act, okay? The first part of the act is called the Emergency Paid Sick Leave, all right? Again, applies to employers with fewer than 500 employees, all right? And this is specifically for an employee who cannot work at home, cannot telework, cannot work at a place of business for the following or one of the following 6 reasons. And the 6 reasons are a government municipality isolation order, which has sent them home and they cannot come into work. Number 2, they've been advised by a health provider to self-quarantine. Number 3, they are seeking a diagnosis because they have symptoms of COVID-19. Number 4, they may be caring for somebody who is subject to the quarantine or the self-quarantine. Number 5, caring for children if the schools are closed or a caregiver is unavailable, and you're hearing a lot about that one especially. And then number 6 is kind of like a drop-off for any other conditions that may come up as a result of COVID-19 as specified by the Secretary of Health and Human Services. So again, this particular Paid Sick Leave Act is only for one of these 6 reasons, okay? And I am really going to emphasize to you, and we've got something to share with you as well, which is a form to help you with identifying which one of these an employee may have in terms of being able to seek the Sick Leave Act. I do want to emphasize this does not apply to an employee who chooses not to go into work. So even if work is there, an employee says, I don't want to go into work and I don't want to be around people, this is not one of those, unfortunately, 6 reasons. Okay? So with that, okay, there is a way to pay them as a result of which reason they have chosen and working with you. So if they choose 1, 2, and 3, and I'm going to look at, it's the government isolation order, you've been advised to self-quarantine, or you're seeking a medical diagnosis for symptoms, one of those three, and if you look at this one, the pay rate for that is full pay, but it is capped at $511 per day, or for 10 days, the 2 weeks, it's only 2 weeks pay, which is the $5,110. Okay, again, 2 weeks pay, 80 hours. Okay. If it is for reason 4, 5, and 6, which is you're caring for someone else or you are staying home as a result of childcare has been closed, you still get 2 weeks pay, but that's only 2/3. All right, so it's only 2/3 pay. And again, it is capped at $200 a day or $2,000. Okay. So again, this is for 2 weeks of pay, only 2 weeks of pay, the sick leave, okay? And you can't really require, okay, the employee to use whatever sick leave or PTO or whatever else they have. You cannot require them to use that. That is their days. Now, they may decide to use that and start it later, but that is their choice, okay? So again, this is the Emergency Paid Sick Leave Act, covers 2 weeks of time based on these 6 reasons. Okay. The second part of the act is called the Emergency FMLA Expansion Act. And this is really for one reason and one reason only. It's to care for a child under 18 if for the employee, if the child's school or place of care has been closed, okay? Again, this applies to any employer with 500 or less employees. Again, the employee cannot work at home or telework. And this is up to 12 weeks of job protected leave. There is no pay for the first 2 weeks or 10 days of that, of FMLA. An employee can decide to use, if they're using this because of the child's school, they can decide to use their own PTO, they can decide to use vacation. If it applies and they use, of the act I just shared with you, they use number 5, which is taking care of a child because their place of school has closed, and they're able to use that for their first 2 weeks, okay? And then for the remaining 10 weeks, the employer would continue to pay them 2/3 of their regular pay, again, capped at $200 a day or $10,000 total. So again, a lot of information here, but remember it's a 2-step type of an act. You've got the sick leave, which is those 6 reasons. If one of those reasons happens to be the employee's school, child's school has been closed, then there's an additional 10 weeks of pay, but only if they can't work, okay? This is not for someone working at home, even though their children at home. If they are actively working at home and getting paid, this does not apply, okay? All right. The sick leave requirements for all of this is there is a notice and a poster that you as an employer must display in your office. And if you've got folks working from home, you can email it to them. And we have a copy of that poster. It has been sent out. And again, we will get that posted so that you have a copy of it or send it out to you. All right. It has everything in it. It has those 6 criteria for the sick leave. It has the pay requirements in there. So it's a very nice poster from the Department of Labor. Okay. But that is your only requirement, is really to make sure that it is displayed. However, I will tell you as a best practice, we are providing forms and documentation in terms of the rationale and the reason why someone is taking leave or FMLA, so that you can keep that documented. You're going to need that for a tax credit, which is how this is all going to be paid for. So this tax credit, okay, applies to both the Sick Leave Act and the Expansion Act, it is a dollar for dollar tax credit to you, okay? If there's a refund needed, there'll be a claim form, but the tax credit is only for the amount noted in the law, even though you may want to give more. So the example for that is, you saw in the past slides that an employer needs to be giving 2/3 pay. Well, some employers may say, I don't want to give 2/3, I just want to give 100%. And that is absolutely wonderful and very kind. However, in terms of a tax credit, they're only going to be able to get back the 2/3. That's what that means. So the tax credit, again, is only for the amount noted in the law, even though you as an employer may be able to give more. Okay? To get that tax credit, and I'm going to emphasize again, you're going to have documentation. You're going to have a place where you can show where your monies are toward payroll, which goes back to what I said at the very beginning, which is, create an expense line, make sure you're documenting everything to make it easier to be able to apply for the tax credit, which basically comes off of what you do every quarter in terms of your quarterly taxes. All right, we've gotten questions around exemptions. The DOL is empowered to exempt any small business in certain circumstances from all of this. We're still waiting on what that paperwork is from the government to be able to provide a hardship. But what that means is that because this is law and you have, for whatever reason, an isolation order, or everyone's working, cannot work because they're working at home or trying to work from home, you're trying to pay them, but it's going to be a hardship on you as a business to be able to pay them, then you may be exempted from all of this. But you will have to prove the hardship, and there will be paperwork for you to fill out. And as soon as we have more information on that, we will let you know. The example I'm going to use here is a lot of restaurants are probably going to prove hardship. Because even though they're going to, trying to pay their employees, if they can't pay their employees even the 2/3 at this point, they can't even stay open. So they may be exempt from doing that law, which is the sick leave law and the extended FMLA. The second part of this is really just an FYI for you, which is the health plan benefit mandate really says that any medical plan right now, insured and self-funded medical plans that cover diagnostic testing for the COVID-19 is going to be covered at 100% without any deductibles or any copays, okay? The mandate doesn't apply to treatment should there be needed, but at least the testing part of all of that will be covered at 100%. The other thing that I will tell you is that I encourage you to work with, Victoria, and work with, looking at your health plan right now, because there are some companies, some insurers who are giving some leniency to payment plans. And right now, that would be something to look at, especially if you're looking at cash flow within your organization, just to continue to talk with your benefits advisor and Victoria around what that would mean. Okay, so with that, I believe that is the end of my presentation, and I am going to stop and see what some of the questions are that are coming through the chat. I'm going to ask Heather and Cindy to help out in terms of some of the questions that are coming through as well. But thank you all.
That don't know where the chat box is, it's up in the upper right hand corner, and it's kind of a circle with a little arrow on it. So please go ahead and ask your questions that direction. Thanks.
Heather, are you able to speak at this point? I know there was a question that I had at another presentation about am I entitled to take my employee's temperature before they start work for the day? Can you speak to that?
Yeah, sure. And yes, the answer to that is yes, you can. It's more advisable to ask your employees to self-monitor their own temperature and not come in if they are experiencing the 100.4 or higher. However, you can still check them at the door, but there's several precautions there. You need to do it privately. You need to not be taking down any kind of information. It's basically a go or no go situation. And if they are at that temperature or greater and you ask them to leave, then that's it. They just leave, and there's no discussion about it, because just because they do have a temperature of 100.4 or greater does not necessarily mean 100% that they are infected. It could be something else that's going on. But we're allowed to err on the side of caution right now as far as that goes. Also, the other thing is if these employees are hourly employees, then you do actually have to pay them for the time that they have come in and gotten their temperature tested. So if you're sending somebody home and they were there for 5 minutes, somebody needs to manually enter that into your payroll system. Just keep that as a note of what else has to be done there. But that's really kind of it. So the answer is yes, you can, but there are things around it that you need to take care to do.
Great, thank you, Heather. Another question that I have gotten as well is, can we require the employee to provide a doctor's note before the employee returns to work? Okay. And again, the answer to that is yes, you can require a doctor's note, especially if you knew that they were being sent home for any one of the symptoms. So the answer is yes, you can do that. Let's see, what else? What else you're getting through the chat, Victoria?
Well, Helene, I think one of the questions we're being asked is, does this qualify for short-term disability? And the answer is yes. If you're quarantined for a reason, in other words, you've been diagnosed, yes, then it is considered an illness. And depending on what your waiting period is, you will be compensated for that. However, you do have to fill out the forms, that information. The other questions you've got through the chat are, what are the implications, or are there any differences if you're a nonprofit?
Yeah, that is a good question. I am not sure I can speak to that at this point. I think I'm going to have to go back and do the research on that. Can you just take the name and email?
Helene, I don't think there is any difference. From what I've seen, nonprofits are included in this at 500 plus.
That's my understanding too. And then another question is, do you have any information about the rate the Department of Labor will pay furloughed employees? And how does the extra $600 per week factor in?
Are you talking about the unemployment piece of that?
Yeah, and that, Helene, goes with the new law, the CARES Act too. I believe, but I'm not 100% here, because we are still learning more information about, but I believe the Department of Labor will pay what they normally do, and that this 600 is on top of that coming from the federal government.
Mm-hmm.
But I'm not going to say that 100%, because I honestly have not seen that specifically stated that way, but that is my belief.
The next question, Helene, and I think we all have this. I just received a DOL 1169 for an employee, but we are open and allowing all employees to work to obtain their hours. This employee has called out, not with COVID, not with COVID-19, and has chosen not to work every day. What do I do with this form?
So they're filing for unemployment.
Yes, based on the fact that they're saying, they've just called out sick. But they're not, it's not the COVID-19. it doesn't
Right.
matter, right? They can't do that. I mean, their unemployment doesn't count for that person, correct?
Correct.
That is correct.
That is correct. Yes. Yeah,
Okay,
unemployment only if they've been terminated or they've been furloughed.
so you would deny the claim in that circumstance? Okay.
Yeah. Mm-hmm.
Okay. If an employee is collecting unemployment through the state, are they eligible for the FFCRA benefits as well?
The answer to that is no.
No, this is not retro.
Well, it's not, and it's you can't do both.
Yes.
That employee has to be employed to be eligible for the FFCRA because it's the employer that's paying that sick leave and that extended FMLA.
And in the past, FMLA has only been for employers with 50 or more employees. In this case, it's for everyone, correct?
That is correct.
The only extra stipulation is that an employee, to be eligible for the extended FMLA, they need to have been an employee for 30 days. It used to be, a year or 1,280 hours, but they have to have been an employee for 30 days.
And
otherwise,
it's one reason.
Yeah.
That got jumbled. I did not understand that.
Go ahead, Helene.
I was going to say, just to follow up on what Heather said, the extended FMLA is only for that one reason. You cannot work because the child is at home because your school or place of care has been closed.
Okay.
Right. And for instance, though, if someone does have COVID and they're in the hospital and it's taking a while, they're past the sick days, and then they are getting the expanded sick leave, they actually follow the same requirements as any other FMLA claim at that point.
But then it would not apply for groups under 50 employees if they're doing the hospital thing.
Right, because again, the expanded is only for if you're taking care of children, not for your own care.
Okay, thanks for that clarification. Someone had asked if we will share the slides, and we will. We'll be glad to do that, as well as do this again on Thursday because of the required, everybody's wanting to know this. The next question is, can hours be reduced for a contracted employee? How does contracted employees feed into this?
Yeah, contracted employees do not feed into this, so you can reduce hours for contracted. However, the new bill that's coming out, the CARES bill, will have some elements that cover contractors and gig workers. But what we're talking about today does not apply to contractors.
Okay.
You can reduce hours for contractors.
So for the part of FMLA that's relative to staying home because you have a child, does it apply to part-time employees?
Yes, it applies to part-time employees as well. And again, the payment for that time frame is going to be 2/3 of the average hours that a part-time employee works over the 2 weeks. So if they're only working 20 hours a week, then they're only going to get 2/3 of the pay of the 20 hours if they're part-time.
Okay. Should decisions for furloughs be made by tomorrow relative to the FFCRA eligibility since it goes into effect on 4/1, or is there a little leeway there?
Yes, there is leeway on furloughs because it begins on April the 1st. Doesn't mean you have to furlough people on April the 1st because the sunset time frame is December 31st. It's the entire year. You may make some different decisions in the summertime than you would be making April the 1st. So you do have the entire year to make that decision.
If you have less than 50 employees and FMLA does not apply, are you still obligated to pay sick leave? now paid sick leave required, or just what we already had in our books?
No, you are the sick leave is required.
For how long, Heather?
It's the same year, from April 1st to December 31st. That's for the FFCRA, that's the time frame for all of it.
And sick
Okay,
leave
so
is 2 weeks.
The sick leave, the thing with the sick leave, though, it does have to relate to the COVID-19, to this virus. So it's covering between now and hopefully this will be gone soon, and then the sick leave part will just kind of fall off. It'll be the extended leave, based on what is happening within your business. If you need to furlough people and do that sort of stuff later, or something else, or maybe the schools are still scared to let people in, who knows what's going to happen, but this is open for between April 1st until December 31st.
So I don't have to pay sick leave all that time. I just have to pay up to 2 weeks.
Correct. If in relation to the COVID-19 virus.
Okay. And then I've got that one. Does the FFRCA benefits terminate if the employee is furloughed?
I just read an answer on that, and no, it does not. If they have started on that and then you decide to furlough them, you still have to pay.
Okay, that seems to be all of the questions we have. I really appreciate Helene and Heather helping us with this. And again, they're available. The Braden staff, while we're available to help you, keep in mind that this is not our area of specialty, but we really felt that everybody needed this information. So we will do it. We will post this on our website. We will do this again on Thursday. If you know any other people that need the information or it would help, let us know, and we will certainly send them an invite. Helene, Heather, thank you very much.
Thank you, everyone.
Thank you, guys.